welcome again to another podcast, the Difaba podcast. I'm your host, Dr. Lillian Kerubo, and here we talk about development and behavior of children, and we talk about some of the causes of it and how we can manage it, how we can help them, and how we can understand them and still have them have a full life, regardless of what challenges they may have. And so this is when we're talking about some of the causes of disability. As we know, disability is one of the causes of challenges when it comes to the development and the behavior of children. And this week, we are going to talk about the events that happen during pregnancy and during birth. Pregnancy and birth are one of the most important seasons that both the mother and the child can go through. And any problem or any good thing that happens during these events affects both mother and child and can lead to disability in the child if not properly handled. The first house that a baby occupies is the womb or the uterus, and events, inputs, and the environment surrounding the womb go a long way in determining whether a baby will be born healthy and strong or whether a baby will require additional support as they grow. This means that it is important what a pregnant mother eats, where she goes, what she's exposed to. And some of the events that happen during pregnancy can result in a child with developmental or behavioral challenges. So we're going to give a few examples. One of the commonest things that can happen in a pregnant mother or a mother who is giving birth, especially in Africa and in Kenya, parts of the world that are still developing, are infections. We have a high infectious disease burden in developing countries, and some of these infections can affect a baby who is still growing in the womb or a baby who is just being born. Some of these infections include viruses, like a virus we know as cytomegalovirus, which is CMV. If a child is infected with cytomegalovirus while still in the womb or during the process of delivery, this child may develop hearing loss or deafness. And we know once you have a hearing disability, therefore speech can become a challenge. Learning can also become a challenge if the people training you are not trained on how to train a deaf child. Another virus that can affect a growing baby or a baby who is being born is a virus we called rubella. Rubella can cause blindness in children, and therefore this can cause visual disability. Another cause of disability is a virus known as herpes. And herpes is a virus that causes ulcers or wounds on the genitalia or on the lips. And if a child is infected with herpes while in the womb or while being born, the herpes virus can affect how the child's brain is going to develop, and this can lead to intellectual disability. Another cause of infections during the pregnancy or the birth period is an organism known as toxoplasma, and it brings about a disease known as toxoplasmosis, which can lead to blindness, and it can also lead to excess water collection in the brain. And if this water collection in the brain is not corrected, then parts of the brain may not develop as they should, and this can lead to intellectual disability. So how can we prevent some of these infections from happening? Because I'm sure we don't plan to have disabled children, but sometimes due to uncontrolled circumstances, we find that we have a child with disability. And so we can prevent these infections from happening by screening all pregnant women. So part of the reason why we insist on pregnant women visiting an antenatal clinic is so that some of the tests can be done so that we can establish whether some of the mother has some of these infections. I know not all these infections are captured in the standard or routine screening guide that we have, particularly here in Kenya, but it is high time that we come together and revise the kinds of screening that our pregnant women are getting in the hospitals when they visit. If we prove that these viruses are causing a great disease burden, which I believe they are, and that are causing disabilities can be screened, we can advocate for the government to invest in the screening of pregnant mother, to expand it. I know we are already screening mothers for HIV, we screen mothers for diabetes, for tuberculosis, and we screen them for a urinary tract infection. But I feel it is time to expand the scope of the screens so that we can afford or accord mothers a safe pregnancy and accord babies a safe delivery and a thriving life after that. One of the reasons we may not be able to screen for some of these diseases is the issue of cost, and perhaps a wider discussion needs to happen on how these screens can be made affordable for every woman out there. Another thing that may happen when a mother is pregnant or when she's delivering that can bring about disability in a child are toxins. Some pregnant mothers may be exposed to toxic materials, and some of these toxic materials include things like heavy metals. There are mothers who work in factories or situations where they interact with heavy metals regularly, including when they're pregnant. Some of these heavy metals, such as mercury or lead, or some medications that may be toxic to a growing baby in the womb, may lead to disability. One of the medications that pregnant women are advised to stay away from while pregnant include things like warfarin. We use warfarin to treat clots. Clots are, so a mother might have a clot in the leg or somewhere in the body. We are advised as medical practitioners not to prescribe a drug like warfarin because it can cause disabilities in the child. There are many other drugs that can cause disability in the child, and if you're unsure of any medication that you're taking during pregnancy, please have a chat with your doctor or just check it up. Most medications have a write-up inside the packaging that they come with that lets you know whether that particular medication is safe to take during pregnancy. Other mothers may be partaking of toxic materials such like tobacco. A lot of mothers still smoke while pregnant. Tobacco is toxic to a growing baby. Some mothers take alcohol while pregnant. Alcohol is toxic to a growing baby and it can cause disability, especially intellectual disability. Some mothers take cocaine or other drugs of abuse during pregnancy, and these are all substances that can lead to disability in the child. These toxic materials can be absorbed because, as you know, the mother and the baby are connected through the umbilical cord. So anything the mother takes, anything the mother is exposed to, anything the mother inhales somehow can make its way into the baby through the umbilical cord. And some of these things, when ingested, they go into the baby's brain or the baby's ears or the baby's eyes, and then they lead to disabilities in the particular area that they have been absorbed. So the advice we are giving all pregnant ladies is to avoid toxic materials or to be sure of any medication that they are taking so that these medications may not lead to disability in the child. If a mother is addicted to some of the drugs of abuse, then therapy and addiction services should be offered to any pregnant lady who has an addiction so that she may overcome the addiction so that the baby is not exposed to toxic materials that can lead to disability. Another thing that may lead to disability in a baby who is growing in the womb is radiation. And following the bombings of, we've heard of the World War when it was starting in Japan, and we know that there were serious bombings in two cities known as Hiroshima and Nagasaki. Following those bombings, babies who were born to mothers who had been exposed to the radiation that came from those atomic bombs showed differences in their appearances. They looked different. They were not as they were not understanding information as much as their predecessor babies. They were developing differently and they were behaving differently. And that's when it was realized that radiation can affect a baby who is growing in the womb. And we still use radiation to this day when we do x-rays, when we do imaging, CT scans in the hospital, they all have radiation. And so it is advisable that any pregnant woman should stay away from any radiation unless it is life threatening. Maybe the mother has been involved in a car accident and therefore an x-ray is required to know, or a CT scan is required to know whether we need to have an operation done on the mother. So those are exceptional situations, but under normal circumstances, a mother should not be exposed to radiation because that will put her baby in danger of developing disabilities later on. Another cause of disabilities during the pregnancy or birth period are diseases that some mothers suffer from. There are mothers who are pregnant and are suffering from diabetes or high blood pressure. There are mothers who have hypothyroidism. There are mothers who have malnutrition, especially in developing parts of the world where food insecurity is a growing concern. And so mothers are getting pregnant while they are not well nourished. And whatever nutrition the mother has, she now has to share that nutrition between herself and her growing baby. So it's highly likely that the baby will not get the adequate nutrition that they need. Some mothers have diseases such as lupus, and these diseases may lead to reduction in the amount of nutrition, oxygen, or any metabolic requirement that the baby may need while still growing in the womb. If a baby is denied or is given less than what they require during the growing period, then parts of their growth or parts of their development may not happen as they ought. And these are children who may be born with disabilities. So any mother who has a pre-existing condition such as diabetes, lupus, hypothyroidism, any mother who is living in a food insecure environment, their condition is to be optimized, preferably before they conceive a baby. During birth, there may be birth trauma. And birth trauma are events that lead to a reduction in the amount of oxygen that a baby receives in the first 1 to 5 minutes of life. The first 5 minutes of a baby's birth are very critical because it is during this time that the baby takes their first breath. It is during this time that the baby's metabolic path changes and they no longer need their mother for nutrition or oxygenation of their body. If anything goes wrong during the first 5 minutes, it can be very critical and it can lead to changes in the brain that can later cause disability in how the brain functions. And we all know the brain controls all the parts of the body. So once the brain has been affected, then this child may end up having disabilities, and this is a condition we later will refer to as cerebral palsy. So it is important to know a mother who may be at risk of experiencing birth trauma or a baby who may be at risk of experiencing birth trauma. And some of the risks include prolonged labor. An old lecturer of mine, well, he's not so old. I'm sure you'll not be happy to hear me referring to him as old. And a teacher of mine in my past life used to tell me that the sun should not rise and set on a woman in labor. And this is just a rough guide on how long active labor should last. By active labor, we mean once a lady is 4 centimeters. Roughly, a day, 24 hours should not pass before this mother has delivered. Of course, I know there may be other exceptional situations, and we have advanced in medicine to the extent that we are able to keep a very close eye on the baby who is still in the womb despite the long hours of labor. However, in most parts of the developing world, in most parts of Kenya, in the rural parts of Kenya, they may not be able to have advanced technology to keep an eye on the baby who is on a baby who is in a womb of a mother who has been in labor for more than 24 hours. And so once labor progresses beyond 24 hours, that baby is at risk. Remember, during labor, the mother's uterus is contracting. Every time the mother's uterus contracts, the contraction squeezes the baby's head. So imagine the baby's head is being squeezed every maybe 10 minutes or every 5 minutes, depending on how often the contractions are. So the baby's head is being squeezed. The baby's head is being squeezed. Every time the baby's head is being squeezed, the amount of blood going to that brain, the amount of oxygen going into that brain, the amount of carbon dioxide being removed from that brain is reduced. And so we try not to have that head being squeezed for too long. So that's why prolonged labor can be a risk of birth trauma. Difficult extraction can be a risk of birth trauma. And what can cause difficult extraction include something we call cephalopelvic disproportion. So depending on how the size of the woman's pelvis and the size of the baby's head, if those two are not appropriately matched, then there may be a difficult extraction of the baby may not be coming in the style or the usual presentation. So normally we prefer that a baby comes head first, and not just any part of the head, but the back part of the head. That's when we can have an easy extraction of the baby. So if the baby is coming out head first, but it's this part of the head that's coming out, there may be a difficulty with removing that baby from the vagina. If the baby is coming out using the shoulder first, or using the hand first, or using the leg first, or using the bum first, all those are challenges that can lead to difficult extraction. And the more difficult a baby's extraction is, the more interventions are required. Therefore, the longer duration of time where a baby can go without oxygen. Because remember, once a baby's head is within the vagina, the placenta starts separating from the uterus. And so the amount of nutrition and oxygenation they're receiving from the placenta is going down, is going down, is going down. If that period takes longer than 10 minutes, then we are in serious problems. Sometimes a mother may lose too much blood, either during pregnancy or during delivery. The blood of the mother is what is feeding the baby, is what is giving the baby oxygen. So if the mother loses too much blood before the baby has been extracted, then this is a baby who is at risk of getting reduced oxygen and reduced nutrition. Therefore, they are at risk of developing intellectual disability. If a mother gets any problem during birth that is not addressed, it can be high blood pressure, it can be trauma. Some mothers end up falling or end up getting hurt during their birth process. These are all situations that can affect the baby who is just about to be born and can lead to disabilities in the baby. We can prevent some of these disabilities that result from birth events by having all women have their babies delivered by skilled maternity or midwifery care, and having the midwives and the people who are delivering the babies, having them educated on the possibilities of birth trauma, how to prevent them, and how to address them if and when they occur. If you are a pregnant woman and you have concerns about your pregnancy, please talk to your gynecologist or your primary care doctor about it. If you have any question, if you have any comment, if you have experienced any of these conditions, please let us know in the chat box below. You can email us with questions at info@difaba.com. You can reach out on our website, www.difaba.com. You can follow us on Twitter @mdifabilities and on Instagram @